Hello everyone. Today we're going to talk about a topic that is often overlooked in daily life. Some fruits must never be eaten together casually. What seems like a simple combination of fruits can sometimes cause gastrointestinal discomfort, affect the efficacy of the medicine, and even have serious consequences for certain groups of people. To avoid the misconception of casually saying, fruits can be eaten freely, I will explain one by one the common dangerous combinations, the scientific or case evidence behind them, and offer practical alternative suggestions. Please write down these key points after listening, especially if you or your family members are taking medicine or have chronic diseases, such as kidney disease, diabetes, or cardiovascular disease. You should be extra careful. Remember to like, subscribe, so you won't miss a very useful channel. We'll delve into more daily foods and drinks that can quietly improve your health from the inside out. The first combination that needs to be vigilant about is not the interaction between two fruits, but the mutual influence of certain fruits and drugs. The most famous example is grapefruit. It can affect the metabolism of many commonly used drugs, causing abnormal increases or decreases in drug concentrations in the body and leading to dangerous consequences. Commonly affected medications include certain statins for lowering cholesterol, certain antihypertensive drugs, immunosuppressants, and some anti-anxiety drugs, etc. If you are taking any long-term prescription drugs, it is best to confirm with your doctor whether you can eat grapefruit or drink grapefruit juice. The mechanism of interaction between grapefruit and drugs has been clearly studied. The components in grapefruit can inhibit the enzymes involved in drug metabolism in the intestines and liver, which will change the level of drugs in the blood, thereby increasing the risk of side effects or reducing the efficacy. The key point is that this effect may last for several hours or even days. Both a single large intake and a long-term small intake can cause problems, so don't take any chances. If your prescription drug instructions or a doctor specifically advise you to avoid grapefruit, be sure to follow them. The second dangerous combination is starfruit in patients with renal insufficiency. Research and clinical reports show that starfruit contains a substance that is toxic to patients with kidney disease. People with normal kidney function can excrete this substance, but those with impaired kidney function may experience acute kidney injury or neurotoxicity, with symptoms including persistent hiccups, mental confusion, syncope, and even acute renal failure. If you or your family members have chronic kidney disease or abnormal kidney function, be sure to consult a doctor before eating starfruit. It is best to avoid eating it directly. It is not advisable for ordinary people to eat a large amount of starfruit on an empty stomach either. The third type that needs to be guarded against is foreign objects in the stomach caused by persimmons, especially those that are not fully ripe or dried. There are multiple clinical case reports showing that after consuming a large amount of persimmons or dried persimmons, hard lumps form in the stomach, leading to gastric outlet obstruction or small intestinal obstruction, which require endoscopic or surgical treatment. Persimmons contain tannic acid, which may form insoluble lumps with proteins and starches under the action of gastric acid. This is especially likely to occur in people who are on an empty stomach, have poor gastric peristalsis, or have undergone gastric surgery. Friends who like to eat persimmons should pay attention to moderation and avoid eating a large amount of dried persimmons on an empty stomach or eating persimmons together with high-starch foods. The fourth point is a rather common misunderstanding about combinations. Eating milk with acidic fruits, such as oranges, lemons, pineapples, kiwis, etc., will coagulate in the stomach, leading to adverse consequences. Scientifically speaking, acidic fruit juice does cause milk protein to coagulate, but our stomachs are already in a highly acidic environment, and coagulation does not necessarily mean harmful substances. For most healthy people, milk with oranges will not cause serious health problems in the short term. However, for those with lactose intolerance or weak digestive function, such a combination may cause bloating, flatulence, or discomfort. Therefore, if you are prone to gastrointestinal discomfort, try to avoid drinking a large amount of milk and eating a lot of acidic fruits immediately after meals, or alternate the two times. The fifth point to note is the combination of high potassium fruits, such as bananas, avocados, etc., with certain antihypertensive drugs or potassium-sparing diuretics. This is not an interaction between fruits, but rather an interaction between food and medication. When you consume a lot of high-potassium foods and are taking potassium-preserving drugs at the same time, the potassium level in your body may rise to a dangerous level, affecting your heart rate. If you are taking ACE inhibitors, ARB drugs or spironolone and other potassium-sparing drugs, you should discuss your daily potassium intake with your doctor or pharmacist and adjust your diet if necessary. Although most people can eat bananas with peace of mind, they should be cautious when taking large amounts of potassium over a long period of time or taking additional supplements. Some folk rumors also need to be viewed rationally. For instance, claims such as seafood with fruits, especially persimmons, grapes, etc., can cause poisoning, or bananas with milk can be fatal, are mostly exaggerated or spread through individual cases. The situations that can truly lead to serious consequences are usually related to individual allergies, drug interactions, previous surgeries, or poor digestive function, or excessive intake, rather than the situation where an ordinary person occasionally eats two kinds of fruits together and an accident occurs. Diabetic patients should also be cautious when eating fruits, dried fruits, grapes, lychees, and other fruits that are high in sugar or can easily cause a rapid increase in blood sugar, can lead to a sudden rise in blood sugar if eaten in large quantities at one time. If you are taking oral hypoglycemic drugs or insulin, you should include fruit intake in your daily blood sugar management plan and monitor your postprandial blood sugar response. For those who need to control their total sugar intake, it is advisable to prioritize fruits with high fiber content and a low glycemic index, and to control the portion size. The relationship between teeth and acidic fruits is also significant. Frequent consumption of acidic fruits such as lemons, oranges, and grapefruits increases the risk of enamel erosion. After eating acidic fruits, rinse your mouth with clean water and avoid brushing your teeth immediately. As the enamel is softened at this time, brushing immediately may increase wear and tear. It is safer to wait for 20 to 30 minutes before brushing your teeth. In addition, people who like to drink juice every day should be aware that juice often lacks the fiber of fruit pulp and has a high sugar concentration. Long-term and excessive consumption is not good for blood sugar and teeth. Summary of practical suggestions. First, people who often take medication should consult a doctor before trying new fruits or fruit juices, especially those taking cholesterol-lowering drugs, immunosuppressants, antiarrhythmic drugs, etc., to confirm whether there are any contraindications with grapefruit. Secondly, patients with renal insufficiency or dialysis should avoid starfruit and confirm their dietary details with a nephrologist. Thirdly, persimmons should be eaten in moderation, especially dried persimmons, and those eaten on an empty stomach should be avoided. The elderly, or those with a history of stomach surgery, should be especially cautious. Fourth, people with lactose intolerance or indigestion should consume milk and strongly acidic fruits separately, or replace milk with yogurt or plant-based milk. Fifth, people with diabetes and those who need to control potassium should adjust the types and portions of fruits as prescribed by their doctors. Finally, let's emphasize 3 more points. First, significant individual differences. Everyone's digestive tolerance and drug response are different, and a one-size-fits-all rule cannot be used to replace doctor's advice. Secondly, when symptoms such as abdominal pain, persistent nausea, vomiting, confusion, palpitations, or unusual muscle pain occur, one should seek medical attention immediately and inform the doctor of their recent diet and medication usage. Thirdly, the content of this paragraph aims to popularize common sense and prevent common risks, and it cannot replace professional medical advice. If you are taking long-term prescription drugs, have a chronic disease, or are preparing to adjust your diet for the elderly, pregnant women, or children, be sure to consult a doctor or a nutritionist first. In addition, attention should be paid to the combination of fruits for diabetic patients. Eating too much of high sugar or rapidly elevated blood sugar fruits, such as dried fruits, grapes, and lychees at one time, may cause a sudden increase in blood sugar. If you are taking hypoglycemic drugs or injecting insulin, be sure to incorporate the portion and timing of fruits into your blood sugar management plan. For people with sensitive teeth or weak tooth enamel, frequent contact with acidic fruits can also increase the risk of tooth decay. It is best to rinse your mouth with clean water after eating fruits and avoid brushing your teeth immediately to prevent damage to the tooth enamel before the acidity is neutralized. Finally, here are a few simple and feasible daily rules. First, eating fruit between meals is milder than consuming a large amount of it immediately after a meal. Second, try to diversify fruits, but not in excessive amounts, adhering to the principle of small amounts and diversity per meal. Third, for any newly discovered adverse food reactions, observation records should be kept and medical consultation should be sought in a timely manner. Fourth, the elderly, pregnant women, children, and patients with chronic diseases should seek professional advice before changing their diet. By taking these careful and practical measures, you can enjoy the freshness and nutrition of fruits while minimizing potential risks. That's all for today's sharing. Don't forget to subscribe and like it so you won't miss the next video. We'll delve into more daily foods and drinks that can quietly improve your health from the inside out.